diabetic foot. So according to WHO, the diabetic foot is is any infection, ulceration, or destruction of deep tissue in lower limb associated with neurological abnormality and or arterial closure disease. Okay, in simple words, infection, ulceration, destruction along with neurological symptoms or arterial closure disease is diabetic foot. Okay, what happens here? We have two things, that one is neuropathy. In pathophysiology, we have neuropathy and vasculopathy. Now, in neuropathy, we have the sensory loss, we have motor loss due to atrophy, as well as autonomic, that is loss of sweating, impaired blood flow, etc. In vasculopathy, what we have microangiopathy and macroangiopathy, as well as third one is infection due to immune suppression. And in vasculopathy, we have micro and macro angiopathy. In macro, what we have ischemia, atherosclerosis, ulcer. In microangiopathy, we have thickening of capillaries. Okay, now let's talk about the classification, that is modified Wagner classification. So we have here three classes. One is 0, 1, 2, 3. Here at risk foot, that is neuropathy is present, but no ischemia. Okay, into ulcer present, superficial, and ischemia without gangrene. Ischemia without gangrene formation. In third one, we have deep ulcer, and gangrene also formation happened. And in last, we have extensive ulceration. And complete gangrene. Okay. Now let's talk about the investigation. The management and investigation will be given. So management and investigation. First one is, I have to do work for the diabetes. So investigation comes in. First is regarding diabetes. I have HbA1c level. We have 24-hour urine output, urine sugar. I have USG for nephropathy, diabetic nephropathy. I have fundus examination for diabetic retinopathy. Next is for infection screening. What I will do for infection, I have wound swab, I have blood culture, I have leukocyte count, TLC, total leukocyte count, and differential leukocyte count, TLC. I have inflammatory marker, that is ESR and CRP, inflammatory markers. I have urine culture, blood culture, urine culture, both. Write it here, urine culture. Okay. Next, I have blood investigations. What are the investigations? I have hemoglobin level, platelet count, liver function test, renal function test, creatinine. In renal function, I have creatinine levels. Next is biochemistry. I have lipid profile, in urine culture, and microscopy is also there. Next, in radiology, I have X-ray, MRI for osteomyelitis. And obviously at the end I have bone biopsy, bone and tissue biopsy, deep tissue biopsy. Right? Now let's talk about the ultimate thing, that is the management. So regarding the management, first I have to treat the diabetes. For diabetes, I will give drug, diet, and insulin. Right. Next, my target will be HbA1c less than 7%. Okay. Manage the comorbidity, no smoking, alcohol, etc. So just write it from the start. That is a management in treatment. Just write it from the start. The treatment. First, I will manage DM managed. Control the obesity. Next, I will give drugs. Here, I will give drug, diet, insulin. Also, the drugs I will give in diabetic foot is low dose aspirin, I have pentoxifylline, improves the blood circulation by reducing the blood viscosity, so it is patla kore blood. And obviously last one is then I have control obesity, care for foot, that is keep it dry, avoid injury, dressing, regular dressing, and obviously last one is MCR, micro cellular rubber footwear. Okay. Next is regarding this, that is surgical management. Surgical management. If infection is a lot, at first I will give antibiotics. But if for infection, I can give incision and drainage. Broad spectrum antibiotics will be given. Open compartments to prevent compartment syndrome. Surgical debridement, remove the necrotic tissue. Also lavage, saline lavage is done. For the trophic ulcer, for ulcer, what is given? For trophic ulcer, this local debridement for ulcer. Okay, and this for this gangrene, if it is dry, then we will just localize dry gangrene. So auto amputation, wait for auto amputation. And if it is wet, then direct amputation. Okay, that's it. One single line can be given, that is, after the auto amputation, polymethyl acrylate beads with antibiotics can be given. Polymethyl acrylate beads, fill the gap with antibiotics.